The opioid crisis has taken hold with no signs of letting up. Tri-state communities, a culture of abuse, overdoses at an all-time high. But what can be done to fight the ongoing epidemic? Tonight, we bring the tri-state area together to start the conversation. Now, from the St. Mary's Outreach Center in Huntington, West Virginia, here are Jennifer Abney and Patrick Simon.
People in the tri-state are dying at an alarming rate.
911 call centers are overloaded, emergency rooms are overcrowded, and first responders are just overwhelmed. Good evening and welcome to a special edition of 13 News at 7. I'm Jennifer Abney.
And I'm Patrick Simon. The conversation begins tonight. We're going to talk about a very important issue that in one way or another affects us all.
The tri-state is in the grips of a drug epidemic like none we've seen before. People are dying at an alarming rate. And according to the Centers for Disease Control, opioids, including prescription pills and heroin, killed more than 33,000 people in 2015 alone. And get this, almost as many people were killed in traffic accidents that very same year. Nearly half of all overdose deaths are involving prescription opioids. And just to give you an idea of the impact that this epidemic is having in our communities, take a look at the numbers. West Virginia, Ohio, and Kentucky all saw double-digit increases in drug-related overdose deaths in 2015. And based on the size of the population with the number of people dying, the Mountain State leads the nation with 725 deaths. And experts believe that that number is even higher today.
For the next hour, our goal is to not just talk about the problem, but also initiate change. How do we turn all of this around?
To help us to find ways to do just that, we've assembled a panel of experts for you this evening from all the fields that are forced to deal with the fallout of drug addiction. We want to welcome this evening Tammy Walls. She is a registered nurse, the clinical manager at ER for St. Mary's. Thank you for being here this evening, Tammy.
Thank you, Tammy.
Beside Tammy is Brad Barnett. He is a licensed substance abuse therapist with Ohio Valley Physicians. Thank you for being here, Brad. And beside Brad is Tim White with Prestera. He is the regional prevention coordinator for that group. To my right is Sarah Murray. She is the nurse manager for the neonatal abstinent therapeutic unit for Cabell Huntington Hospital. She is also the co-founder of Lily's Place. Besides Sarah is John Matthews. He is not only a West Virginia native, but he is also a filmmaker, and he just recently came out with Opioid Inc., which you will be able to see on public television in June. Thank you, John. And J.D. Gandy is with Celebrate Recovery out of Charleston with River Ridge Church there. Thank you for being with us this evening. We will also, of course, be talking with our audience this evening, and we'll be inviting you to ask questions. And John, I know that you talk to many people throughout the state when you're working on your documentary, and you even talked to some families who lost more than one family member to this epidemic.
Yeah, I mean, I was talking to Pat earlier, and, it just seems like, just my Facebook newsfeed used to be happiness and just birthdays and celebrations, and it just became overran with deaths, overdose deaths. Mm-hmm. This person or that person, funerals. I did a documentary called Surviving Cliffside, and back in 2014, and since then, it was set in a trailer park that was infested with opioids, and since that time, 3 of the cast members have died from overdose death, and one of them was a 5-year-old little girl who found her mother with a needle in her arm, 18-year-old mother. So it was just like, growing problem. And then, as I did the Opioid Inc. film, I just found so many horrible stories like that. And, Jonathan Duncan, who we were just talking about, who, had 2 brothers and a mother who died from prescription drug overdose. When he was talking, I thought he was talking about the same brother, and then he's like, no, this was a second brother and his mother as well. So, yeah, it was just one horror story after another.
And Tana, you have a very important and inspiring yet emotional story to tell about your son. Talk to us about that.
My son was very intelligent. He was outgoing, funny, but he got involved in drugs when he was probably about 18, and he tried to fight the battle, but we know that he lost it. But my family and I are determined to go out and try to help other people to succeed with their hopes and not lose it like he did.
Lieutenant, thanks for sharing your story. Appreciate
You're
it very
welcome.
much. Thank you.
And Tim, this is something that you all work to do to actually help with prevention, and I know that's a theme that we're going to continue to talk about this evening as well.
I think it's important to understand that people don't wake up and decide today I'm going to be a heroin addict. The Substance Abuse and Mental Health Services Administration did a national survey of young people across America. Over 70% of those kids in the survey said, I can get tobacco, alcohol, and prescription pills at home. It doesn't mean that mom and dad are giving it to them, it means they have access to that. And what we find out is a lot of kids, 11, 12, 13, they start experimenting with different things. Some of them, it's a one-time thing and they're done. Others, then by 15, it's something else and into their 20s. So the first line of education and defense is in our homes, talking to our kids. Kids listen to parents, so it's very, very important that we do that. Then we have to limit the access to our kids to those negative items, the tobacco, alcohol, and prescription drugs. We have drug takebacks in all of our counties. It's very important that you have a proper way of disposing of any unwanted or unused medication that you have.
Next, a life-saving tool in the fight against opioids, or is it actually enabling addicts to seek out their best high? Stay with us.
You are a hostage to it. It takes complete control over any and everything that you've ever thought, lived, loved, anything.
We will return to a town hall meeting, States of Addiction, Fighting the Opioid Epidemic.